biggest, easiest thing to do is just to make sure that there's enough sheet up over their shoulders. Now, in this space, I talked about if there's like a mirror or other people in the room, to be sure, if you have to just cover their head. That's okay. That way when they turn, there isn't a window here. The way to do that, typically how you would want to do it in a traditional setting, is that you just want the sheet to be fully touching the ends of the table up at the head. Now, we want to clarify what size we want them to turn on. Right shoulder is the goal, so I'd rather work on that last. So I can clarify that, and that can help me expect which way they're going to twist. But just remember that as long as you do it the way that I showed you, you're protected. And if like they were to turn and hit you, the idea doesn't hit you in a body area you wouldn't want to get hit. So you kind of turn, put the lateral side of your leg contact here, and then don't create a big tent. Hold it like a taut tarp. And then they can turn either way and the sheet is anchored. But I can more clearly tell a person, but use tactile messaging. They're going to be gone, right? So don't say rights and lefts. They don't know what that means. I will use right and left, but use a touch-based contact. So I'll say, all right, what we're going to do is we're going to have you turn onto your right side with your left side up. I incorporate that. So I'll say, all right, we're going to turn you on your right side with your left side up. Give me a moment. All right, go ahead. Now, a couple of things with Sideline. The areas that do frustrate people is there's more moving parts. You have more bolstering and pillows and stuff. I'm sure he's a snotty mess from being stuck in prone for so long. So that's a big argument of not getting lost in prone like that, okay? Now, got a person set up. Couple of things that right now, if you want to just limit your issues with Sideline, to confirm. Are they low enough where their head is actually on the table? Yes, we have him actually on the table. Is he far enough back in this direction so that when I'm going to work here, I'm not reaching? I don't want a person laying really far to that edge of the table, because then I'll be reaching the whole time. So I might have to ask a person to scoot down and to scoot back. I'm standing right here behind them. I can like hold the sheet in place, and then I ask that. I'll say scoot down, scoot back, until they're where he's basically at right now. Once I have them there, I know I'm pretty much good to go. The next thing that I need is, actually I don't have, I use this one. Hello? Remember, at a broader shouldered person, you can easily just take the face cradle and use that for some additional support. Go. Go. Okay, head up real quick. Okay, there. Get the face cradle completely out of your way. Either fold it down or just take it out. I'm more conditioned to just taking it all the way out. Now, here for other means of like helping with draping. One classic one is to find the edge of this sheet and ask a person to lift your head up and tuck that underneath their head. Now, if we're going to work on everything, what I ideally want access to is the arm as well. So this is the part where you undrape just their back, and we're going to say, okay, we're going to bring your arm out for me. I'm going to hold the sheet. I'm going to have them do the work. And I help just control the sheet. If they can't move the arm, then you're in a different kind of territory and you'll have to figure that out. But have them bring their arm out. You don't bring the arm out. Then pillow or blanket or towel goes over top of that arm, and now they can be nice and cozy. But now that sheet is anchored real good across the chest and allows me, for let's say it was an all Sideline position, we can get to the arm. That's already holding the sheet down, will make it easier to get to the back, all that stuff. Other options include giving the client a pillow to hug. This also can be really helpful in Sideline, because then they can just, that's not perfect, it would be underneath. Sorry, doing this a good job. Ideally, I would have had it set up like this. I don't tend to use that front pillow as much just because I incorporate a lot of like movement stuff, but that totally could be a, you know, pillow in a pillowcase, set that underneath. They can be hugging it like that. That helps support and keep them not like rolling too far forward on you. And there you go. So there, and then the bolster. So it's a few extra things, but once you just get kind of conditioned to it, it's really not that big of a deal. All right, bottom leg straight, top leg bent. There. And then getting a person untwisted is always a mission. And there we are. Working up here at the head, always be sure to sanitize. Kind of just a perception thing / it's a good sanitation construct since you're going to be near the face and all that, right? So, all right, client's officially set. We have at least all of this taken care of, and we can move on. Now here at the head, I'm going to try to scoot along a little bit. I don't have a perfect statement as to the most body mechanic friendly way to work here. Probably this is the best one right here because my elbow is more straight and I can rest this hand. It's a little bit confusing when you're observing it because the hands are crossed over and all that kind of stuff. This hand is just resting at the base of the skull, just behind the ear. Like literally the medial side of my hand is contacting the back of the ear. And then this hand can come over to the front of the ear and I can be thinking about the temporalis muscles. And this is one where as I was thinking about how to give people a recommendation for best body mechanics here, this one at least keeps the wrist and elbows from being as twisted. So this is really good. And you know you're doing good work when the ear moves. You should see the ear move. It should look like I'm opening the ear up and closing it. That works good. As opposed to the one that I use the most, just because it's one that's worked for me and it doesn't bother me, is I do it this way. But that's obviously, from an instructor's standpoint, not the best, but I have more options with how I stress the muscles, especially the temporalis muscles. It's important to get good at working here, especially temporalis. I mean, we'll get frontalis at the very end in supine, but the main muscles here of like the skull proper that could be part of like tension headache and especially potentially related TMJ related issues. It's temporalis. And it doesn't get worked on nearly as much because supine doesn't really allow you to work on it very effectively. People will work on it more with like fingertip based pressure. It's a pretty large muscle. It's more efficient to go with a full broad contact point. So here, moving that muscle in a variety of directions. Come around. As I'm doing this, make sure you can actually see everything. I would have left the sheet. You have to be always cautious that your hand is never going underneath the sheet. And that's the no-no. You can be adjacent to it, but like usually I leave a person with all these bunches and stuff, so it's maintaining modesty. So you can see more effectively and get more of these clean folds. But while here, this is where I use the palm. And when you're watching this, it's just that like I'm setting my palm, making contact, and doing actions like this, or turning my hand, actions like this, even here. Everything's getting set and then not twisting and moving secondarily. So here, then I move. Not just grabbing like that. Now that's the same thing here, that whole idea of gathering the tissue into your fingers. That's how I create that perception of the trap squeeze, which can feel really good. It also can be very intense. This is where some finger strength can be used. There's options where I can do one set of fingers on one side and on the other. That was the better one. So I just set my hand here to create a block, and then I'm just gonna and that'll create the pinch. This hand, now what I usually do, this palm comes over top of those fingers and helps support that. So it ends up being my palm and my fingers are working together to create the application. These are things where it's really hard to show you right at the beginning because it's like stuff that you can't see observationally and all of that, right? But that's how I do that kind of point-based work, even here. Now I'm showing this is not what I ever do in like common practice. There's this stuff, using your palm to come up into the head, like all this feels good. Like that little routine, I'm sure, is wonderful. Mine looks more like this, where I will have done all that, smush the head, warm up the shoulder and neck stuff, and I'll come in with a forearm, confirm where everything is, and just making sure what the shoulder and scapula is relative to where I'm at. I'm gonna let myself go downhill. Yeah, that was a good roll. You all right there? Start again. It's a tough one where like you really should focus more on going uphill, but there's certain places where the incline is so extreme, like the foot and prone, where that just never made sense to me to try to say, well, just force your way through it. If you can control going downhill, it can work really good for you. And it's also a little bit of a way to change up how you're using your shoulder. So this one works really good for me. It's worth considering as an option. This is what it would look like if it was a soft fist. It would be making contact, then this is too sharp of an angle, and then it'd be letting gravity just win over time, like that. I think it feels really good. It's body mechanic friendly for my shoulder, so that's how I do the stuff here. And even here at the cervical area, well, you want to get really good at palpating and identifying what a spinous process is, and then we want to be just adjacent to that, and then applying forces away from the spine. That'll always keep you in a safe orientation from ending up in the anterior triangle, but you want to avoid all the stuff here. That forearm works really good here. I'm not holding the head down aggressively, I'm just keeping my hand rested here so I know where his skull is relative to his cervical spine. There. Then across. Now that covered most of the cervical spine. The next application is going to be how I get to the upper portion, like atlas axis. Now this is one where everybody's always liked it, but what's important to remember is I'm making contact with the skin, but I'm not applying a lot of force here. I'm just making contact with the skin, and then I'm gonna let gravity carry my arm into the cervical spine, and then I'm gonna work my way finally uphill here. So this is real light, just grazing along. Then I get myself set, my way up into the base of the skull. And I know it seems scary to think about a forearm here at the base of the skull and into the neck, but it's a broader base compression. It's actually substantially safer. And then pressure. Now here, we're not going to go through all the elements that you could incorporate here, but if you're ever going to help somebody with headaches for real, then this is it. And this is all there really is being able to effectively apply a forearm at the base of the skull. And I swear to you that there is never going to be a more efficient and effective way to help with tension and even secondary effects from migraines. Even if you can't help the actual vascular nature of what a real migraine is, it will cause a lot of secondary muscle tension in the muscles of the skull and at the base of the skull. So eye strain related headaches, traditional tension-based headaches, maybe from postural stuff. It does not matter. Breathing pattern related stuff. It's all hiding back here.
Can I ask a question?
Mm-hmm.
Are you familiar at all with cluster headaches?
I mean, to a vague extent. Like if we're talking like in the, usually kind of categorized, is it somewhere in a vascular arena like a migraine or not? So I'd have to do some additional research.
My brother-in-law struggles really, really bad with cluster headaches.
Mm-hmm. And how do they manage, like sensation-wise? Is it just kind of? That's part of where I would always ask is
it's
how
like
does a person
his whole
describe
head
it?
is like being squeezed, and he'll be like rocking back and forth, like moaning in pain.
That sounds like it's
horrible.
more real, probably more vascular, probably more similar, if not in some ways, are migraines. But that ends up being the question. Is it a vascular related issue where it's truly happening inside? That's harder to deal with.
Yeah.
However, secondarily, so much of that and the discomfort that you feel is related to the symptoms that manifest from everything else getting tight in response. You can't be in pain without there being a breathing change and a postural change. It's just an innate reflex we have. So it doesn't matter where the pain is, you kind of go into this hard shell thing. In order to make more room for your esophagus, once you do this, you kind of crane forward at the same time. So what's short once I get here? So whether it be pain-induced stress, which causes breathing, which then causes tension headache, or it's headache causing the righty. I mean, thorough work here, and especially there. Now, when symptoms are really acute for a person like that, you should be pretty careful. Like if they're having the migraine, they're having the cluster experience, it's really tough. Usually your best suggested applications there are like long duration cold compresses and not massage. Okay. You can irritate it because the body's already just dealing with so much that sensory input can just be overwhelming. Yeah. It's in some ways not dissimilar to like trying to work with a person with like vertigo or inner ear stuff. Sometimes that's just going to be a bad time and you're not going to be well suited to do a lot of like stuff here until it's less acute, at least like a day or two out. But then ideally what you can help, you can never prove this, you can never prove what you prevent. But ideally, if you can track and lessen the occasions of it, you know you're on the right track. So, yeah. Okay, now I'm trying to be a bit more mindful. I might have to put him through one sideline experience and then supine, because then you can kind of reflect that I'd mirror this, and then I'll balance him out. But that's the way I'll try to save us a little bit here. For the low back, we're not going to worry too much about arm and other stuff to start with here, okay? For the low back, that's the first one I want you to get good at. We're going to come back to how to work on the arm and the lateral side of the torso more in the future. I've just learned over the last couple of cycles that dealing with like controlling the arm while working here and dealing with the scapula gets incredibly frustrating. So I would rather show you how to make sure you focus here and get to the low back really good, and we will come back to this stuff, okay? Here at the low back though is an essential piece where I take it back real quick. Let me at least show this so you have it in the demonstration. All right, so now what do I need to do? I have to bring the arm back towards me. So we're going to roll back on the shoulder. This is where this is going to become so important. If I'm going to be doing a lot of shoulder mobility stuff, then I have to be mindful of what's happening with the sheet across the chest. So this is where I just can't think of anything better to show you than that. You need that, it could just be a pillowcase that lays across the neck here and covers that chest. And you just don't have to worry anymore. Rather than dealing with only the top sheet, even if you have to take the blanket for a shortened period of time and turn it into this, I mean, that's just, I don't have a better one to show you. It doesn't matter what it is, a piece of fabric that lays like this so that now I can do all of this and not be worried about what's happening here. That's the biggest hack. The other one is making sure you have a person roll back enough in such a way where you're actually going to be able to get truly on the lateral side of the torso. That is dependent on them being far enough back on the table so you're not reaching, and them also laying a little bit more in line. Now, the table were a bit higher, and client was even more broad-shouldered, and he's broader shouldered. The challenge here also is your biomechanics, because you'll feel like you're reaching, trying to get on top. So that's where the hydraulic table or those step stools, those athletic steps. It's the only way to really do it. Otherwise, I will show you options as to how to work here in other positions, but the challenge can be sometimes you're this low and you're stuck working like this. You really got to make sure you bring them like laying truly on their side with their arm back. Now, the easiest one here to work on the lats, which are a really important muscle. And we got to start real posterior armpit. We only got to go about that far, okay? The length of this glide / excursion is going to maybe be 5 or 6 inches. And that's it. We do not need to carry this down onto the ribs. There's nothing there to worry about. And it tracks more posterior. It starts here and turns into the lumbar dorsal fascia of your low back. So if you look at that big anatomy poster, that giant triangle that runs from the bottom of the shoulder down and turns into the white thing on the low back, see how it starts at basically the posterior armpit and then runs posterior. So I have to try to visualize that. What will annoy you here is how to get an application here that doesn't feel like it's too much on the ribs or on the scapula. And you want to be essentially what feels like to you more on the ribs. So what I'm doing is I'm using my forearm, I'm pulling a little bit toward me to try to nudge the scapula out of my way. Now I can just kind of figure out my biomechanics and sink in. Starting out, my easiest suggestion for you to do what to do with their arm is just lay it on top of yours. And you're not holding it up. It takes the tension off what you're pushing on, so it'll make it less stretchy and burny. And then I created this a little bit because I wanted to control the sheet because I didn't have this. So it allowed me to hold the sheet against the front of their chest, and then I just do this. And then that's all it was. I come back up. Now, what's worked really good for me is this. See how my hand is? I just do this. Now, their arm ratio to yours may not make this possible for you. But this was my big hack of how to work here. You can just hold the arm up like this. That ends up feeling like a lot of work. Depending, but you can get a lot more mobility out of this. But this, or just this. Good contact. We'll troubleshoot how to be just on the lateral side of that scapula. Because then now ideally what I'm doing is I'm actually kind of taking that scapula and shoulder into a better postural position. This is really good for breathing stuff because I'm also compressing the ribs. So the person, I just say good deep breaths. Now I'm creating resistance every time they breathe when he inhales. I'm actually assisting with the exhale just by applying pressure on the ribs in this direction. So it's a big win-win. To start with, that's all there is. Arm stuff, all that ends up being is you have to create those sandwiches. It's going to always be some kind of kneading element in the arm. You have to use your other arm to control it, to pull that off. Okay. Low back. Here, seeing the shape that exists here, we got the floating ribs and the iliac crest. This is a much larger space on this model than most people have. What you don't want to have your force track up into is the floating ribs. So that's why not this, this. As long as you stand on an angle where your force is directed towards the pelvis, then you're going to bump into the top of the iliac crest and then be able to use that to track you down right into the structures of the low back. So here, I just find it, there it is. And then I'm going to start trying to go straight down into the table. That's how I'll get on one set of structures here. So a lot of stuff comes over and attaches into the side of your low back. Three of your abdominal muscles, the obliques, transverse abdominis, and then real deep, even psoas and quadratus lumborum. Now, rarely would you ever be pushing deep enough to be really getting to that deep, deep layer of stuff. But even if you dent the surface stuff, it's still affecting the things underneath, right? And then breathing, because a lot of this stuff attaches onto the ribs. So I can use just breath to start with here. The other cheat, if you haven't seen me talk about this forever in all the other videos, if I wanted to incorporate a really safe and effective muscle under technique here for the low back, I'm going to ask the client to just real small start to lift their leg, their bottom leg, up off the table. This creates a co-contraction between these lateral flexors, abductors, and these adductors. So let's see what balancing reflexes. So all I gotta do is push, instead of client real small, start to lift your leg up off the table. Everything associated with the lumbar, lateral lumbar to posterior lumbar area will contract. It will concentrically shorten. Again, should say more isometrically, sorry. Now I can start real lateral, which if you see that in most other example videos, they call that a QL or a quadratus lumborum release. Now I can just change my elbow angle, can step a little bit further away, increase my elbow angle, and now I'm going to be more on the erector spinae. I can even orient my elbow in such a way where I can be about as much on the SI joint as you could hope to. It's just you have to be, I'm just kind of starts here, increase elbow angle, and then I can turn a little bit that way so that my elbow is oriented towards the SI joint. Right here is a place where you can, the most safely possible, work on almost any low back related thing. Because the question is it the lateral structures? Is it the posterior structures? Is it the SI joint? And with all that, obviously if it's something related to the spine, that could be, but what is the issue at the spine influencing and causing an effect in? It's between those three spots. And then starting out, all you got to do is make sure you confirm with the client, like, hey, which one of those feels like the thing? Like you ideally, palpation-wise, will be able to identify where does it feel like there's exaggerated tone. But then after that, you always want their feedback so you can clarify. Okay. And scoot leg back. What we'll do, deciding we'll stop after this side, and then I'll just wrap it up post-lunch. Give the brains a break and everything anyway. All right. With working on the leg in Sideline. The only thing I really can think of to be careful about is like really make a good bunch so there's a barrier for you related to making any inadvertent contact, and orient your strokes. If you're using your hands, make sure your hands and your fingers are pointed towards their knees, right? The only place where this could feel and seem inappropriate is if fingers were to go that way up underneath the sheet. So don't do that. Stand in such a way where that's just not going to happen. Then more importantly, just worry about forearms. Now here is going to be a theme that runs a little bit, even considering when we, if you remember, when working on the anterior upper thigh in supine, the quads, where it's kind of stand in the same place but do the same series of applications. But a lot of that also can be you're standing essentially in the same place, doing what looks like the same glide, but it's about your contact. Is my elbow angle less or more? This contact point is going to come more straight down on the table. It's going to hit these medial structures. If I increase the angle, I'm going to make contact with the posterior structures. But all I'm going to do is stand in the same place and do what looks like the same glide. One is going to have a less acute elbow angle, so I'm on the adductor, the medial thigh muscles, and then I'm going to increase my elbow angle, so I'll be on the hamstrings. There'll be adductors, hamstrings, adductors, hamstrings, adductors, hamstrings. And then maybe one more, because I identified that maybe the hamstrings needed a little extra attention. Something through there. And done. This portion of the calves, very similar. Big thing I hope that can be registered is that the needs don't have to be super big ringing actions. So also when doing this, you can just plant your hand and let the wrist pivot as you apply the forearm. So what the client's then feeling, I clearly know where I am. Here's one hand, here's the other hand. Calf muscles distorted in one direction. There were the small needs that took it in that direction. If the area needed more attention, then I come at it like this. Incorporating joint movement whenever possible. Okay. Now here's the the one issue I have a little bit is his height off the edge of the table. What you always want though, especially when you bend the knee like this, all of their legs should be touching the table. The lateral leg should be touching the table so that the knee isn't twisted in a weird way, okay? As long as like they just should be laying there with like hooked up like this. They either need to change where their pelvis is at. That's where usually this will save you, so you don't have to deal with that issue. But then I'm able to bend the knee and put the foot in a better orientation. Now here, I can apply all the forces that are helpful, but and there's other content out there that I've done that goes way more in depth. the simplified reason why this works so good is if I stabilize the heel bone, calcaneus, that's the biggest of the tarsal bones, and I move the rest of the foot, I'm gonna get all those structures some shear. Gonna give all those jointed structures some shear forces and keep them as mobile as possible. That takes stabilizing calcaneus and then moving the metatarsals. Okay, rest their toes by your wrist, bring that forearm in. I can't think of anything that does better. And I started with that heel squeeze and twist, and that's what I end with. So I start that, go in, good forearm applications, and then end. Okay. Coming around. We will demonstrate this, but this is a place, for example, I tend to skip because I have worked on this lateral portion of the hamstrings in prone, and I will work on this portion of the quads in supine. Now, what you have to be cautious of here is the draping. So usually this foot has to get uncovered so you can create a big enough bunch. I actually want the sheet to be a little bit underneath this leg, between them and the bolster, and then I can move this up. Now that's where the other sheets then become useful because I can cover them up like this. Now if somebody wants really specific work on IT bands, then hey, this gives you a pretty good angle for it, right? So it works. Needs are easy. Now, in terms of working here, pushing directly on IT band isn't going to do a whole lot for anybody. They might create a sensation that they enjoy, and it's not going to necessarily hurt anything, but that's just deep fascia. It does not have a lot of like tonal shape change. It will get short and tight because of the muscles that it actually attaches to. It's one giant tendon. It's a case where basically it's a tendon that's bigger than the muscle that it attaches to, instead of it being a muscle that has small tendons on either side. The muscle that shortens it and controls it is up here. So that one we would need to target. What it usually needs help with is getting pried off of the stuff next to it. So if I stand, that's a little bit awkward because of the nature of the bolster and stuff in the way. But I want to feel like I'm gliding along the line between IT band and hamstrings, so that it should feel like, and my intention is that I'm separating the hamstrings from IT band. And then I'll switch and do the other arm with the same goal, but now it's the quadriceps from the IT band. Specifically vastus lateralis, which is just the name of the lateral quad. There's 4 of them. They're not named too bad. There's one on top called rectus femoris because it's on the middle of the femur. And then they're all named vastus something. Vastus lateralis, vastus intermedialis or intermedius, and vastus medialis. If I was going to work more on the hip flexors, let's say it's an all sideline position routine where I can't get to supine, then this would be how I could get to those. Forearm can work, but you usually get stuck reaching a lot, so it ends up being a case where pretty easy to find. You can just track this out, find the greater trochanter, and I want to be just anterior and superior to that. And I can hold on to their leg like an anchor for counter force, and there you go. This does work pretty good. I prefer, as said, if I have access to it, to just do all of that in supine. But that would be something that you get to determine based on your routine. Do you want to do it that way for most of your sessions or in supine? Okay. Here is my favorite part for real kneading. Remembering that there's, well, I guess you wouldn't be remembering, learning there are two compartments of muscles here when we think of the shins. So you have a tibia and you have a fibula. That's the tibia is the big one. Now, right there, kind of when you think about the midline of your shin, right? You go medial, there's no muscle there. There's nothing to worry about. That's for Thai kickboxing. All right, now over here, you have a group of muscles that are more about bringing the ankle up into what's called dorsiflexion, or bringing the toes up into extension. Then sitting on the femur, the fibula, sitting on the fibula are three muscles. The traditional wording for them are the peroneal muscles, but peroneus longus and fibularis longus are synonyms. Same muscle, just how it is. The peroneal name is for the peroneal nerve that innervates them. But fibularis is kind of getting more traction, thank goodness, because they attach on the fibula. Now they do eversion and some elements related to plantar flexion, but predominantly think of them as these everters. So two groups that sit right next to each other. And then you have these groups of muscles back here for your calf muscles. A superficial group that becomes the Achilles tendon, and then a deep group that sits on the posterior side of the tibia, but runs down through this medial channel into the arch of your foot. And then those are the muscles that do plantar flexion and toe flexion. What's cool long term is if you learn this group, you'll also know that deep group. There's a tibialis anterior. This is underneath gastrocnemius and all the Achilles muscles. Tibialis anterior, tibialis posterior. Extensor hallucis longus, flexor hallucis longus. Extensor digitorum longus, flexor digitorum longus. So they're named directly opposite for each other, just in position and function, and they're outright on the opposite sides of the tibia, so they're antagonists to each other. Then these are just named the fibularis muscles, longus, brevis, and tertius. Now, knowing all that, the reason why it's a good point to bring all that up is this is a place where you can affect every single one of those in one go. It's just a matter of how good your intention is and how you change your application. If my palm application or my forearm is set in such a way where I'm just lateral to the tibia and focusing more on those, then I'm getting that group. If I come more forward and I'm right here, then I'm going to be on the fibularis group. If with a kneed action, I pull in such a way where I'm lifting and bending and twisting that whole giant group of muscles that becomes the Achilles tendon, that's going to create more space for those smaller muscles underneath. So as a kneed, palm, thinking that tibialis anterior group, that big collection, the gastrocnemius and soleus becoming the Achilles. Now both of those have been affected really good, and even the deeper group, which would have been addressed more on that, the bottom leg. I mean, you can see how much of a twist you can get here. There's no better angle for working on at least as many muscles at once than here. You could argue a little bit the same like in the forearms, but then I can incorporate lots of stuff with joint movement. So forearm angle more acute, so I'm more anterior, and then anterior group, and then on the lateral group. And I can figure out all kinds of different ways to hold onto the foot and do actions while I do this. I hold onto the foot at the very least so they don't slip away from me. So I either pick to hold the foot like this, and I do that for some applications, or I hold the foot like this for some applications. Either one will feel good. But this one I can just do more of this dorsiflexion, plantar flexion action, or I can think about inversion, eversion. And there. Not my most graceful set. And last but not least, probably what most people consider the best feeling part, at least my sessions, is this version of the foot, where you'll see my fingers can either be more broad and flat or more curled. If I curl them more, I'm going to be really targeted and it'll feel more intense. And then that top hand just glides right across the front. So you can't see it, but this is what's happening. And then I'm just picking, where are these fingers set? They can be in a variety of locations to create stress into particular structures. The classic and most, one would be right here and something related to the arch. But I can find like there's something more over here as opposed to there. Yeah, there's a little something there. Now when doing this kind of work with your fingers, bring all the fingers together. Pressure should be mostly on the middle and ring finger. That's the ones that you can support. Now here's a true shear stress, where that's holding the first metatarsal down, and then I'm shearing the other metatarsals back and forth. You have a couple small groups of muscles in between each one of those metatarsals. And they're very important. So the ability to open your hand like this, that doesn't happen here at the finger. It happens between the long bones here. So same thing with your toes. People are going to have better dexterity with their toes. Moving their toe back and forth isn't going to do it. We have to shear the metatarsals and metacarpals. And that ends up being this huge, that right there ended up being a big reason why I did so well in orthopedics, is because I just understood simple little hacks of how to help a person's foot and ankle work better. And that's something that gets missed. And these angles just give you a much better way to do that. I can't do that in other positions nearly as effectively. And it's like, it can be a lot of fancy jibber jabber, but really, it's just, can you position a person so that you're, pushing those structures in the directions that they ideally need to be able to move in.